Reddy, you were speaking earlier on about the challenges that you faced in the context of a newly formed state and trying to respond to the pandemic. Just talk to me then about how do we future-proof health systems against those kind of pandemics that you've spoken about from a governance perspective as well.
As I said earlier, governments will have to be focusing on two things. One is preventive care, and the other is curative care. And looking at this from the lens of how to improve this healthcare, one would have to be talking about availability, accessibility of healthcare, and also affordability of healthcare. All these three would have to be moving in line. In order to do that, from my state's perspective as to how we have been wanting to move forward is, we've taken every 2,000 people, every population with every village with 2,000 population as a unit, and we're coming up with village clinics.
Okay.
And then we're taking up every 30,000 population as a unit and classifying it as mandal, and where we're coming up with 2 PHCs, primary health centers. These primary health centers would have 4 doctors, 2 of the doctors present in each of the PHC center, and they would be given an ambulance 104, and each of this doctor would be given their designated villages. So 5 villages or 4 villages, depending on the mandal size, to each of these doctors. And these doctors, every alternate day, would hop onto the ambulance and visit the village. And they would become the family doctor for that village. Very soon the doctors, because they've been designated only those 4 villages, so they would start to identify people by names. And they would use this village clinic as a hub. This village clinic primarily would be having an A&M, nursing graduate, mid-level health practitioner, and ASHA workers that we spoke about also reporting there. So that would take care of the preventive part. Now comes the curative part. The curative part would be dealing with the community, with the district hospitals, the teaching hospitals. The area hospitals and the teaching hospitals are going to play a very critical role there. So there we're coming up with every parliament taken as a unit. In order to ensure that there is equitable distribution of teaching hospitals, because only when you establish teaching hospitals, you have postgraduate students actually coming up there, and only when you have postgraduate students doing their course there, and these teaching hospitals are connected to a hospital, a teaching hospital as well. So teaching college and teaching hospital together would become the tertiary care that we are looking for.
Thank you very much. It's very encouraging to hear all of you. I think 2 things, and then I'll come to the question. First is, I think the pandemic has shown us fundamentally, if health is not prioritized, everything can come to a stand down. So Chief Minister Reddy, it's so encouraging to hear you. To you, my question would be that strengthening of the primary healthcare system requires a lot of effort. We know of the doctor population ratio. We know that we don't have enough doctors, but the pandemic has also shown us imagining new partnership, the religious communities and their assets, for example. So that's the question to you. And the second question, of course, is to companies like AstraZeneca, which have made such a huge difference in the transfer of not only intellectual rights and products and vaccines. India is a beneficiary. India is also a contributor. Is how do we keep children as priority? I'm not asking our colleagues from UNICEF, but I'm asking you. I come from a country where 44% of the population are below 18. They have been the invisible face of the pandemic, to quote UNICEF. They will need 24 months, if not more, of investment to just come out of this crisis. How can we put, and to you as well, how can we put children back on the roadmap? They are not our priority at the moment. And you were speaking of resilience. One of the things that we say in public health, I head a Gandhian organization in India. We say it's mental health, when we speak of mental health and resilience, we say it's a connection between internal assets that a child has and external resources that a society provides. The pandemic really has shown us that that link has to be established. So to people who can make a difference for children from outside, UNICEF keeps advocating, but we have missed many opportunities to do that. And to you, Chief Minister Reddy, it's so wonderful to hear you speak about the healthcare system, but it will require persistence. Already this year, the central budget in India has a shrunken health budget. So how do we keep that going? Thank you.
Thank you.
The Minister start?
It was a very lengthy question. In fact, put forth a lot of them. But as she rightly said, we have constraint on the funds. But yes, this is something that we need to deal with it. And in spite of our difficulties, we're pushing through with it. And we've allocated a 3-year window where we're wanting to mobilize $2 billion, 16,000 crores into this whole setup. And we are heading in the right direction, and we will do it. And as far as the doctors are concerned, as you've just spoken, we do understand that this is a predicament that we need to deal with it. And that's exactly why we are trying to open up more medical colleges. We're coming up, the state had 11 teaching colleges, medical colleges, till our regime had come in. Now we are actually opening up 16 medical colleges. So covering taking every parliament as a unit, so that there is uniformity in distribution. And a teaching hospital and a medical college together would provide for postgraduate students to come in and provide for the healthcare.
Thank you so much, dear speakers. I'm Nupur Kohli. I'm a global shaper from the Amsterdam Hub. We are young people between the age of 18 and 30 from the World Economic Forum. I also work for the largest healthcare insurance company in the Netherlands. So my question to you is, looking at healthcare resilience, what do you think is the role of healthcare insurance in many countries where it's actually not available? And I feel it's a primary human right to also have healthcare insurance in many countries.
Is there a specific person that you'd like to answer the question, or is it open to the floor?
I would like Mr. Johansson and also the dear Chief Minister to answer those questions, how you view that. Thank you.
As she rightly pointed out, this is a major concern. In fact, to address this, the country as such had, under the leadership of the Honorable Prime Minister, had launched a program by name Ayushman Bharat. It's a more or less a combination of, it's more like an insurance part where the state governments are also involved in settling the claims. The funds come from central government, but it deals with 1,000 procedures or so. That is not sufficient, it's inadequate. So in the state of Andhra Pradesh, we have widened that scope, and we have come up with our own insurance scheme. It's called YSR Arogyashree scheme. I named it after my father because that's the kind of priority that I give to that scheme. So I just want it to be remembered, and I want to do a good job out of it. So what we have done is we've scaled the number of procedures to 2,446. From 1,000 what the central government supports, we had increased that to 2,446 procedures. And practically, we have distributed cards to 1.44 crore houses. And we've increased the limit for the eligibility of this card to income limit of 5 lakhs per annum. So anybody whose income is less than 5 lakhs per annum is eligible for this card. And 1.44 crores out of the total households of approximately 1.5 to 1.53 crores cards that households that we have, 1.44 crore cards are covered under this scheme. Okay. And last 3 years, we've helped almost 25 lakh people get treatment free of cost here.